Thank you very much. It's a pleasure to be here. So I will speak in French. I will do all my speak in French, but I'll be really happy to take questions in both French and English.
It's a great pleasure for me to be here today. I was asked to give you an overall vision, to give you an overview of what's going on in primary care in Canada, and also explain to you what the College of Family Physicians of Canada is proposing. I'm not going to give you a case study. I'm not going to talk about one single case of innovation, but rather an overview. The objectives of my presentation? Well, I'd like to begin by giving you a vision. It's been said this morning that, well, we know what the characteristics are of a high-performing primary care organization, one that uses innovation. And then I'm going to explain the current situation. What are the different examples that have been set across Canada? And then, of course, we will propose some actions in order to continue the reforms that have been started. First of all, what are the characteristics of high-performing primary care organizations? As a vision, then, this is the vision of the College of Family Physicians of Canada. This was drafted 2 years ago already, in September 2011. It's the patient medical home vision. Now, what this is, for us, it's our roadmap to help guide the members and to help orient our development of this solution to improve primary care in Canada. And there's a lot of literature to root all of the data in this vision. And I'll go over the highlights of the vision, and I'm only going to talk about several of the elements that are proposed. We are proposing 10 pillars, 10 objectives of what this patient's medical home would be. And this is one of the themes of the meeting here today, to become more patient-centered. And I think at the end I'll be able to propose a few solutions. For us, to be patient-centered means to be interested in making their patients our partners, not only in the care they receive, but in the whole line of services that are offered in community. It's really to give them a voice. And of course, the team-based care is one of the essential elements of this vision. We have to talk about timely access as well. Timely access is not a symbol element. It's offering the right service by the right person at the right time. It's not necessarily a visit, or it's not necessarily one specific physician. There are different options, but what we are promoting are these advanced access models, but also a change in the scope of different professionals. That would be another way to improve the timely access. And of course, we include comprehensive care. There's also the continuity of care, of course, that not only means the continuity with one single professional, but the coordination of different care providers. We've already heard examples of a lack of coordination in previous conferences. And of course, we're talking about electronic health records and access to health information. It's not the only way to improve the whole experience, but it's one of them. And education and training, you'll see different models for virtual training that exist. They should be areas where we could help develop professionals further, and we also need to ensure system supports. And by this, we recognize the importance of proper funding and compensation that is aligned to the needs, and we support different types of compensation models that exist for physicians. And this seems very promising for the future. And in terms of evaluation, we're talking about integrating improvement and evaluation and continuous improvement elements within the whole continuum of care. So basically, that's our recipe, that's our vision, and this is what we call the characteristics of high-performing organizations. So in Canada, now we're going to give you a very quick overview here. Most of you are familiar with this, but in case you're not, I'm just going to very quickly go over what's been done in a few provinces. In BC, it's not these organizational models per se that are very different, but they've worked on supporting what comes under the guidelines. They've worked on advanced access, and doesn't seem to be giving a lot of results yet, according to the last statistics we heard, but they have been working on advanced access. And in Alberta, they started setting up these primary care networks, but as Minister Horn said, there are other models available that are being studied now. There's been some projects in Manitoba, in Ontario. In Ontario, sometimes we joke, we say there's about 10 different models. That was the province that was the most innovative, using the family health teams, the family health groups. You see all the acronyms here, a lot of innovation there. In Quebec as well, we have our family medical groups, the CSSs, and in which the hospitals were merged with the frontline clinics. And there's been other changes in other provinces as well, but not so many that are strict new models. These are all people, they're all CEOs, they're all administrators. Now, all of these models are all related to the rest of the system. So you have to deal with these new organizations, and you're able to support them. So what has this given us? Just a summary of the reported outcomes. Now, in terms of patient-centered care, does it improve patient-centered care? Well, I'm talking very generally here, population studies, not a case study in a specific clinic in a specific region, but we have been able to study the overall patient-centered approach. More and greater number of people do declare having a family physician, but their overall perspective is mitigated. And in terms of the satisfaction of the users, well, those who do have access to the system, users who do use the new model seem to be satisfied. In terms of the efficiency, are very little data on the efficiency per se of these new models. A number of data come from different provinces on the improvement of care for chronic diseases, which in Alberta or BC has even led to a reduction in the hospital days for complications. There's been a greater number of individuals who receive team-based care, and there's improved work satisfaction, which is something that is very important as well. We're not only talking about physicians here. Now, there was a survey done that was published about 2 weeks ago by the Health Council of Canada. There's one of the questions asked was on access. How many physicians claim that in their practice, not necessarily them, but in their family practice, how many patients have access to same-day or next-day access? Does my pointer reach? Yes, it does. Between 2006 and 2012, there's a leveling off in the access, which is probably what has not improved the most. But if you look at province by province, you'll see that in some areas they have better results than others. And in BC, it's interesting here, but the physicians in BC seem to have improved their advanced access more, and in Ontario as well, where there's more innovation. So it might have leveled off nationally speaking, but there are certain pockets where there has been improvement. Now here, and I think it's already been said, but we are having trouble with the link between the frontline and secondary line services. We always address frontline services. We're trying to improve primary services, or sometimes we look at secondary line services. But it's when our patients leave the hospital or leave the ER, only about 16% of family physicians in Canada receive information on their hospitalization, whereas it's much more frequent in other countries. I think there's there's no province that has seemed to have settled that problem in Canada. So why is there this leveling off? I think we are headed in the right direction, but our models, do they have the necessary characteristics to be highly performing systems? Here on this chart, you'll see an evaluation by an expert group. This was published by the Canadian Foundation for Healthcare Improvement. It was published last December. This is a strategy for change in frontline services. In our policy orientation, where we succeed very well, we've also been very successful on improving interprofessional teams, but we haven't invested a great deal yet on the participation of users. We haven't invested a great deal on improving the quality per se. So the support and leadership development, there's still a lot of room for improvement. We've worked on the structures a great deal, but I think it would be time now to look at different processes as well. So in wrapping up, I'm just going to talk about some possible actions in order to continue the reform. Some of them are personal reflections because they come from my own family practice, from my own research. But in listening to the talks this morning, I think my first point remains very true. I think we have to have a true conversation on the vision we have of quality, not just a policy statement, but we have to discuss it amongst ourselves, not only on how we want to improve access, but how do we develop the means necessary. Things as simple as being able to pick up a phone and make an appointment. It doesn't have to be very complicated, but we need a vision in order to come up with solutions. And I think that the patients must be involved in the redesign of the system, not necessarily at the highest levels on boards, but where people need to make the improvement. And I think this is an important element of our proposal, and I think there are solutions that are easily available there too. We need to support quality. To change is difficult, but in your organizations of which you are CEO or senior leaders, you have levers in hand quite often that to help professionals change their practice, and that's very important. And we also need integration and coordination. At the College of Family Physicians of Canada, we're trying to take advantage of the levers as they exist. We're working on information, but we're also developing toolkits to help clinicians to get engaged. So a toolkit to help timely access, to help improve patient rostering, and also to establish partnerships with you, with the different institutions across Canada. Thank you.